point, the most hard-hit area in the world is India. The case rates have risen dramatically, along with hospitalizations and deaths. And despite the fact that India has an enormous vaccine industry, the rollout of vaccines has been very slow. So, Zarir, what does the situation look like right now in Mumbai?
The situation is grim, to say the least, in Mumbai and right across India. We reached a total of 20 million cases just today. I think this morning it was. And it's sad to see a country of 1.4 billion literally brought to its knees, gripped in the stranglehold of this virus. You know, as a TB researcher, I never imagined I would see in my lifetime an airborne pathogen more deadly than TB and MDR-TB. How wrong I was. The situation is beyond crisis point. As I said in a comment to the BBC a few days ago, beds in hospitals have been completely overwhelmed. That's one thing. But just the lack of oxygen, that very elixir of life, is just too horrific to even imagine. In across hospitals, across the country, deaths occur in ICUs because oxygen supplies are literally running out. I mean, who would think that death by asphyxiation can occur in a country with superpower pretensions? What do other patients do? They're forced to sit it out at home, and they can't get oxygen cylinders there. They're sold at exorbitant black market rates. An O2 concentrator is a luxury, bartered again at black market rates. And all in all, the situation is just horrific, incomprehensibly grim.
Zarir, I'm curious about the situation in your hospital. Is this an uneven distribution of oxygen, or is this really affecting everybody equally?
It's affecting everyone. So what we have done is stopped using central oxygens, moved to concentrators, and giving the more mild to moderate cases about 3 or 4 liters at the very most on an O2 concentrator, conserving our central oxygen for the more sick patients in ICU. We have regular audits of oxygen consumption on a day-to-day basis. And late last night, I got a call saying that in one of the hospitals I worked at, we were 2 hours away from oxygen supply being terminated. Now, I've got a lady on ECMO in that hospital. I've got patients on 100% oxygen, high-flow oxygens. And it was appalling. I mean, you had to chase every contact you knew in a desperate attempt to just get oxygen to get you through one more day. So it is being rationed, but it is a desperate situation.
Is it being rationed at the government level, the hospital level, the provider level? Is there a system that guides the rationing, or is it a free-for-all?
It is a free-for-all, basically. Each hospital is desperately competing to get oxygen delivered to it by the government, by the municipal corporation, and that supply is very patchy because the central source is just not there. Singapore is actually sending tankers full of oxygen on special planes. I mean, who would thought that we'd need to import air? And it is sad, isn't it?
Zarir, what do you think underlies the rapid increase in cases in India?
Well, there are too many errors to catalog. But if I can be frank, I think first and foremost is complacency and lack of planning. You know, by January 2021, this year, cases across the country were genuinely dropping to very manageable levels. We were seeing about 10,000 cases every day across the country, which is nothing. Now, instead of girding our collective loins at that stage, preparing for the second wave, which was almost certainly inevitable, wasn't it? The government sat back. We basked in global praise. We accepted credit for what, in my mind, was just the natural ebb and flow of the virus, or just good old-fashioned luck, if you want. Look, this was when we needed to be ensuring our oxygen plants increased their production, vaccine supply was ramped up, social distancing, masking messages were hammered home. Instead, what did we allow? We allowed massive election rallies in 5 huge states. Each one of these states is bigger than most EU countries, by the way. We allowed a huge confluence of 3.5 million pilgrims at a religious festival at Uttar Pradesh along the banks of the Ganges, the Kumbh Mela. And it's sad but true that in India, religious sentiments and nepotism and political machinations trump public health principles and just good old common sense. So complacency, lack of planning. And then, of course, we must talk of variants like you did at the start of this podcast. And there's little doubt in my mind, as a physician who spent the last 400 days battling this virus, that this wave seems to be caused by a completely different strain. Now, when I say seem to be caused, the sad truth is we just don't know. We are so behind, so backward. Our basic science community has let us down because we probably have done sequencing on less than 0.01% of all our strains across the country. So we just don't know whether this present wave is driven by the British variant, whether it's driven by the so-called double mutant or the B1.617 lineage. That is, has a double mutation E484Q and L452R. But what I can say as a clinician, and an observation I can make, is that this strain seems to be far, far more infectious. Why do I say that? If one person in a family has this time round, I can almost be certain that the whole family will get down with the virus. It is that much more noticeably infectious. And, with India's crowded houses and communities, this is a wildfire situation. I would also guess, and again, this is not stuff that Eric would get into the New England Journal of Medicine, but I would also guess that this does seem to be a more virulent strain. I'm seeing more sick people this time. I'm seeing the demand for ventilators skyrocketing. A ventilator bed, by the way, is just close to impossible to get anywhere in the country right now. And I also feel that it is affecting the young more. And I don't think that's just because the vaccine has been given to more old people, because we'll talk later about vaccines and the penetrance has been poor across the population. But I've had far more deaths in this second wave, tragically, in those in their 30s, in their 40s. So it does seem to be more infectious, it does seem to be more virulent, and it does seem to be affecting the younger more than the older in this second wave. But those are just clinical observations from a physician who's been looking at cases right from the start of this pandemic.
Zarir, as a basic scientist who spent some time in India, I'm well aware of the very strong and huge basic science capacity in India. What happened here? Why aren't those strains being sequenced?
I think projects are being set up, but you know how the UK has an ongoing daily surveillance system. That's the kind of thing you need as a second wave rolls out, surely. So the ICMR has set up a project, but it's looking at small pockets across the country. I've just got data on my desk from about 30 states, which says that fortunately, for example, the South African variant is almost not seen at all. 0 to 1.5% was the prevalence, the highest in Kerala. And that's fortunate because the Chadox1 vaccine, which is the main vaccine in this country, is not effective, as we know, against that strain. But we have very patchy surveillance from across states in the country. We don't have any nationwide sequencing project. And surely that is the scientific need of the hour.
So why has the introduction of vaccines been so slow in India?
That is another sorry saga, and it makes my blood boil. It's a scandal all of its own. So look, we basked in our vaccine superpower status, and we just did not get our basic math correct. We failed to realize that a country the size of India would need, I would say, about 1.6 billion doses to inoculate its vast population 2 times over. Instead, our chief vaccine manufacturer, the Serum Institute of India, Pune, was given an order by the government of just 15 million. Now they're desperately being told to ramp up capacity. It's too late. You can't do that in an instant with something as complex as vaccine production. We did not allow any other foreign manufacturer entry. Isn't it sad that Pfizer was keen to give lots of vaccines, but we denied them the license and instead of wooing them, turned them away. And then with generosity bordering almost on the insane, we donated vaccines to 90 countries, neighbors, political goodwill, neighbors, other countries as well, so that around the mid of March, we had donated more vaccines than we had actually used in our own population. Then there has been great vaccine hesitancy, as there has been in parts of the US and parts of Europe as well. But that, of course, has now been replaced by vaccine desperation. And each of the 3 hospitals I work at also serves as a vaccine center. And there are desperate queues, almost wild mobs, no luxury of 6 feet distancing or 3-meter distancing. And I do believe that vaccination sites are also super spreader events. You know, Eric, common sequence is you go for your first shot of vaccine, 8 days later you get COVID, or 5 days later, or 10 days later you get COVID. And this ends up giving the vaccine a bad name, when really they probably contracted the virus in our super crowded vaccine centers. So in a sense, doing more harm than good. What I'm also seeing, and this is most frightening, is people getting bad infection. We talked about the ultimate aim of a vaccine, whichever it is, keeping you out of the morgue and keeping you out of the ICU. Well, I am seeing people in the morgue and in the ICU 6 weeks, a full 6 weeks after they've received one of the two Indian vaccines. Now, that is frightening because, for example, with the Oxford vaccine, the UK and Spain, I know, are allowing 1 to 3 months even between the first and second doses. But I'm seeing people who, after 6 weeks, when you would expect a good antibody response to have set in, such patients still coming in, not just contracting mild COVID, but coming in with severe COVID, needing the ICU, needing the ventilator. And finally, of course, we therefore don't know how these two available vaccines hold up against the variants. I know Dr. Fauci made a plug for the indigenous COVAX and its efficacy against the double mutant, but I couldn't find a paper to back that claim, really. So sadly, what we've seen is that about, I would say, less than 5% of the Indian population is vaccinated. And if you punch that into this lovely app called Time to Herd, which you must all have seen, it sadly shows that we are 700 days away from herd immunity, conservatively put at 70% receiving a vaccine. So we've got miles to go, haven't we?
Zarir, you've spoken eloquently about the lack of resources to care for the very large number of patients that you're facing. How much is this a COVID-specific problem in India, and how much is it due to underlying issues in healthcare?
That's a good point. We've chronically underinvested in healthcare. We spend less than 1.4% of our GDP on public healthcare, and all that is coming back to haunt us. You know, we are trying to get medical students to double up. We're getting non-allopathic doctors of all faiths and persuasions. We're trying to get retired physicians to step in. There is a huge manpower crunch as well. And we have chronically underinvested, as I said, in basic things like manpower and public health.
Right now, is the issue a shortage of physicians or a shortage of healthcare personnel? It sounds as if there's a shortage of a lot of things going on.
You're quite right, Eric, but my colleagues on my COVID rounds are a neurosurgeon, an orthopod, a pediatrician, a palliative care specialist. So everyone is rolling up their sleeves and pitching in, but it's exposing for example, the great gaps in the number of chest physicians, ID specialists, and intensivists who really should be at the front of this battle.
Zarir, you point out a much bigger problem, which is just the physical infrastructure. You've vaccinated a small number of your population, yet in the process of vaccinating them, you paint a picture of crowded situations that are super spreader events. And without the right infrastructure to be able to deliver vaccine or deliver care, the downstream realities get worse.
Absolutely. I see these beautiful pictures of vaccine centers in Europe and the US where you're respectfully masked up and keeping safe distance from one another. This is a chaotic stream, a melee of people just crowding around to be vaccinated. And bear in mind that no vaccine is going to save us from this second wave now. It's too late already. So it will maybe protect from the third wave when that inevitably sets in. But it is too late for this desperate population to be saved even now by the vaccine. Though, of course, as a priority, we need every school, every general practitioner's clinic to be doling out the vaccine. But that's if we had enough of it in the first place. So on yesterday, I think we had 400,000 cases, which was a global record across the country. But it was also paradoxically the day when vaccinations were at their lowest. Only about 5 or 6 centers throughout Mumbai, a city of 15 or 20 million, actually had any stock of vaccine. Now, this is controlled by the government. So the government will distribute it to the state and the state will distribute it to different vaccine centers. So from the top up, there has been a screw up.
Your description of what's going on at vaccine centers raises the question, Zarir, of what's going on in terms of public health measures. Do people wear masks? Are people getting the message that they should be wearing masks and avoiding crowds at this point?
At this point in time, everyone is masked. The roads are deserted except for ambulances wailing around with sirens. But I see every single person who I pass on the otherwise empty streets masked up just now. But it's too late for that again. What needed to have been done was really, as I said, around January or February was a wonderful period of time. And when physicians ask me from all over the world, how did you do so well? How did you get rid of this virus? The honest answer, of course, was that we lucked out, really. I think it was just the natural ebb and flow of this disease. And that was the stage to, as I said, ramp up oxygen capacity, ramp up beds in ICUs. Not easy to do at short notice, but China has shown that it can be done. And of course, to hammer home the message of universal masking, double masking, if you will. But that just wasn't done. We let our guard down collectively. We weren't instructed to do otherwise.
I mean, you remind us, Zarir, of the interpandemic period. We've been dealing with this for decades, where we have a pandemic of some sort. We have a chaotic response locally, globally. The pandemic quiets down. We've seen this with Ebola, Marburg, among others. And then in the interpandemic period, we become complacent and focus on other priorities. With SARS-CoV-2, we've had surges and then they regress. And do we learn lessons from the surge to be able to plan and prevent the next surge? And I think what you're describing in India does not sound that different than in other parts of the world. Unfortunately, the variant circulating and the way in which it's transmitting is leading to a utter disaster. But this complacency, when we seem to be gaining control, is its own problem in diminishing our proper investment and planning.
True. I enviously saw pictures of people in the UK, for example, thronging into pubs, into restaurants, at even a concert. And you wonder if that's wise, even though they are on top of the situation, have large percentages of their population vaccinated, you would feel the need to be more wary, even in this situation. Would you agree?
I worry a lot about what is going on in parts of the world where congregating in indoor settings without masks right now, to me, is worrisome for igniting repeat transmission events. And this also has to be looked at in relation to forces beyond simple social policy with weather. When it's sunny and warm out, such as in the summer here in the US, there's naturally more distance in how we interact, and how that may be exacerbated in the winter when we then have crowding again. And we see this with influenza and other respiratory viruses. And my thinking is, I don't see why SARS-CoV-2 won't behave like respiratory viruses, and therefore may take advantage of different aspects of human behavior.
Yes, you talked of indoor overcrowding, and remember that 50% of Mumbai's vast population lives in slums or tenements, poorly ventilated, not uncommon to have 8 or 9 people sharing a room. And you can understand how a virus would thrive in a situation like that, and explain the large numbers of cases we're encountering.
You've already mentioned, Zarir, that you're seeing a lot of family transmission, and these are conditions that should really lend themselves to that.
Zarir, you've outlined a number of the domestic issues that are facing India right now. What can the international community do to help?
That's a hard one for me to answer as a physician, but yes, we do need oxygen concentrators, ventilators, all urgently. But think of it, this is a drop in the ocean, isn't it? To distribute them across a country the size and scale of India, it's going to have a limited impact at this stage, according to me. The US is sitting on a pile of unused Astra-Oxford vaccines, which I don't think they plan to use. Clearly, some die of too little, some of too much. And perhaps I may be bold enough to say that these unused vaccines could be donated to countries like India. Many of them were manufactured here and then sent across. And that would be a big step forward, having access to, say, 50 million vaccines in a hurry, which our own plants are not capable of doing at short notice. I also heard that the US and the Biden administration was blocking supplies, or not blocking, but had not released supplies of some essential vaccine components. At least that's what the Serum Institute of India claimed. And this also was contributing to slowing down vaccine production. Perhaps they might take note of that and release these. And then the vaccines are protected by strict patent laws under the TRIPS agreement, as you all know. India and South Africa have pleaded at the WTO for a waiver of these patents, so manufacturing could be ramped up by multiple providers. Now, I don't know if we have the know-how to use reverse engineer vaccination like this. We certainly did for HIV drugs. Cipla, for example, was an Indian pharma company which took HIV drugs cheaply and off patent across the world. But perhaps on a broader scale, this would be another measure which might just help. But this grim wave that we find ourselves in the midst of, we're just going to have to fight off literally one-to-one, because anything coming is going to be too late.
I echo that. And I'm afraid that depressing news is absolutely correct. We could get vaccines in tomorrow and they wouldn't have any effect at all on what's going on today. They wouldn't have an effect for months. Having said that, though, as you said, India has an enormous capacity to produce vaccines and drugs, perhaps the largest in the world. And it does seem like there's a missed opportunity here. I will say that, as you suggested, it's more than simply patents, though. There's the technology to make vaccines is also important, especially given the fact that some of the newer vaccines use technologies that are not currently employed for other vaccines. And so the effort to get vaccines made in India would require not only the intellectual property issues, but it would require help. And it'd be very nice to see that going on, even if it didn't make a difference today.
So transfer of technology and scientific know-how. You're quite right, Eric.
Zarir, getting back to Lindsay's point earlier, where a chaotic response is followed by complacency and the opportunity for yet another chaotic response when we have a resurgence. What should India and all of us learn from this? What could make a difference to the next outbreak or the next wave? What should we be doing?
I think it would be foolish if we haven't learned from what's happened, but everyone has short memories. One looks back to happier times and forgets how badly you've been battered. But I think really masking, for example, in the foreseeable future should just become a part of life, is what I would say. And using the window of opportunity that a natural wave and ebb produces to shore up capacity and to really be ready for the next wave when it